Good morning, everyone, and welcome to our educational webinar. We thought it would be timely to discuss COVID-19 and all of the new developments surrounding workers' comp, specifically for employers here in California. So wanted to welcome you, trying to make it light and airy for this Friday here, but really we're so excited that you could join us for this educational kind of update. Why do we provide the education and prevention? Well, this is the reason why. We spend 95% of our time working on prevention and protection. The more we can help prevent things like safety, injuries, then it helps us protect all of you and get you the best coverage and at the best prices. So we'd like to share what's coming up, what's new developments, but also to what you can do to put in place the best preventative items in place. We're going to be talking about workers' comp, specifically the executive order, and then I'll be going over the WCIRB changes as well too, and how to impact your company. Welcome everybody. My name is Tony Shibiyama. I'm the Chief Risk Officer. In fancy terms, what does that mean? I'm in charge of prevention and also insurance coverage. I want to welcome all of you that are our clients and also our friends. I'm very excited to have our guest speaker, Peter Louie. Peter, a lot of you may have worked with their firm before. They're a predominant leader in defense in regards to litigated workers' comp claims. A lot of you have used some of their attorneys. As you know, they fight. They're your advocate. And as you know, some of the litigated claims tend to drag on for a very, very long time, but they are in your corner to have the resolution that best fits your needs as well too. So Peter, thank you so much for joining us today. We're going to dive into the agenda here today. We're going to go over the executive order. We're going to go over the WCIRB COVID-19 updates. We're also going to take a look at some estimated costs of the executive order. Also too, I'll be kind of putting on my hat in regards to forecasting what we're going to see down the road in regards to the workers' comp market, and then just some reminders for employers as well too. So starting off first, I know most of you currently right now actually may have employees that have COVID, may have contracted COVID, or coming forward or getting tested for COVID right now. And so the timeliness of this webinar hopefully will answer some of your questions. It may create more questions, but you do have on the side there a chat box. So if you do have questions, we will have a session at the very end that you can ask specific questions that maybe pertain to your specific situation or maybe a claimant right now as well too. So Peter, I wanted to welcome you, and please let me know. I'll be your Vanna here to start off, but please give us more information in regards to the executive order N-62-20 and how to impact employers in California.
Thank you, Tony. Thank you for having me. Thank you, SNK, for having me. Good morning, everyone. I know it's a Friday, so I'll try to go through this as quickly as possible. But obviously, this is a very important issue. The coronavirus laws that just came into effect can have some devastating effects on the workers' comp system. And as a new law, we need to know it and know how to react to it. But everything I'm going to tell you is from my initial vantage point of looking at the law and anticipating how it's going to be handled. But it's a new law, so no one really knows how it is going to be litigated, how judges are going to react to it. But it is here. I am an employer myself, so I'm concerned about it. We've already seen claims coming in. And there's a lot of animosity and a lot of litigation tactics to be discussed between applicant and defense counsel already. I've been in the workers' comp system for more than 30 years, doing workers' comp defense only. And I can tell you that in the 30 years, there have been presumptions, and every presumptions that have come down the pike have been a bad thing for workers' comp defense and for carriers. This one may be bad, but we'll see. But in an effort to see why we are here now, you have to look at where we were before. Going into 2020, we had years of workers' comp claims being under control. Costs have been reduced. Premiums have been down. And then 2020 happens, and then all of a sudden, beginning in February and March, coronavirus hits, and all of a sudden, the whole state of California is upended. So what happened is, after the stay-at-home order issued, essential workers continued working. Most essential workers were healthcare providers, first responders, grocery stores, gas stations, the Costco's, and so forth. So they kept working, and there was, of course, a lot of claims for coronavirus. People contracted coronavirus, filed claims under workers' compensation, believing that it was caused by work. Statistics show that of those claims being filed, about 41% were healthcare providers, 32% were first responders, and 11% were grocery workers and auto workers, gas stations, etc. And of those claims that were filed, most every claim was delayed. In the state of California, you have up to 90 days to delay a claim, investigate it, and then accept or deny it. At the time of the survey, only 28% of 1,000 claims were accepted. 37% were still under investigation, and 36% had been denied outright. And from an employer standpoint, it's hard to accept a claim where you don't have any idea where your injured worker caught the coronavirus. And because of that, it was hard to accept those type of claims. Still is. So only 20% of these claims were being accepted. And a lot of the unions, the healthcare providers, first responders, became very upset. And obviously they wanted some type of legislation to come into effect that would protect them, that would protect them from going to work, continuing to work, and continuing to be exposed to coronavirus. So Governor Newsom, of course, was under a lot of pressure to do something. And after all that pressure came this executive order. And this executive order is what we're going to talk about. But just to let you know, there are other proposed laws involving coronavirus that might be that may extend our concerns. But for now, let's talk about this executive order. First of all, you have to know that this executive order that came into effect in May affects only claims from March 19th to July 5th. So it's a very limited time period that your injured worker has to be found to have had coronavirus, either by a positive test or a diagnosis from a physician or a surgeon between that time period. So those are the limited claims that this executive order would apply. Next slide.
Peter, do you think that they may be looking at extending that after July 5th at all, since it looks like it's only going to be one more month? Do you think that they prematurely put July 5th, and do you foresee them extending that number out or that date?
I certainly expect either that or another law. There's another Senate bill that just is being discussed right now, which has no expiration date and creates a rebuttable presumption for all critical public and private sector employees who contracted coronavirus while employed to combat the virus's spread. So that's another law that might come into effect shortly. Whether this gets extended, I don't know, but that's another issue that might come up. So we're talking right now about a limited time frame, but coronavirus is not going to go away anytime soon.
Right.
So I expect something further down the road, whether it's a new law or an extension of this executive order, I don't know yet. But a lot of employers are anxious to find out because a lot of the employers that are trying to decide whether to reopen have to take into consideration whether this law is still in place. So who knows? That's my answer.
Thanks.
Okay, now, so let's look at the law itself. So again, it has to be a positive finding of coronavirus, either by a doctor's diagnosis or a positive test during that time frame. And then once you have that positive test, the second issue is you have to show that that injured worker has to have had been at work, the workplace, 14 days prior to the diagnosis, within those 14 days. So if somebody comes to you and says, I got positively tested on today, then the first thing you have to look at is the 14 days prior to that test result, was that person at your workplace at your direction, meaning they weren't working at home. This does not apply to anybody who had been working at home for the 14 days prior. It has to be at your direction that he was working at your workplace. And finally, 30 days after your diagnosis of coronavirus, you have to take another test to confirm that you did have coronavirus through another test where supposedly antibodies will show that you were positive. All right, so once you have that in place, then you have a rebuttable presumption. Next slide. Okay, now once you have a rebuttable presumption, what does that mean? That means that the injured worker's claim is presumed work-related. And if it's presumed work-related, then that injured worker has the right to all benefits under workers' comp. So again, from an employer's standpoint, if you have somebody that comes to you and says, I have coronavirus, and I think it's work-related, and they get over the presumption, then it's up to you to rebut it. And under this law, you don't have 90 days to rebut it. You have 30 days. From the day the claim is reported, you have 30 days to investigate a claim to see if there's anything you could find out that could lead to a denial of the claim. And if you don't deny the claim within those 30 days, it's presumed compensable. And that's a big, big burden on us, because when you have a presumed compensable claim, who knows what happens with these injured workers. A lot of them recover and nothing much happens. But those small amounts where you have pre-existing and you have hospitalization and you have long-range effects stemming from coronavirus to not only your respiratory system but other body parts, you're looking at a large claim. And then there are people who actually die from coronavirus as well, and they're entitled to death benefits as well. So it's important for us to look at this claim and take into account you only have 30 days. It's a very important time period because it's the only time period you have to find a way to deny the claim. Now, I think that the vast majority of these claims are going to be presumed compensable. But if you can find a way to deny a claim and not provide benefits, you need to do that within those 30 days. And that's why it's important to know when a claim starts and to conduct your discovery as soon as possible. Once the injury is presumed compensable, again, you're entitled to all benefits under workers' comp. And we already anticipate that injured workers are going to claim not only pulmonary problems, but anything that can also be affected or could be a cause from the coronavirus. What I'm saying is that I expect applicants' attorneys to not only claim pulmonary, but they're going to claim psych, internal, orthopedic, etc. The claims we've already seen that they're adding body parts beyond just the pulmonary. And if they can find a doctor that can say that somebody was psychologically disabled because of coronavirus as well, then all of a sudden you got a valid psych claim. You can find a doctor that says your stomach problems were due to the coronavirus and the medications you're taking, then you have that as a compensable body part. So what I'm saying is that the workers' comp system is not, it can be expanded beyond just the limited scope of coronavirus and the pulmonary impact it has. And again, you have every aspect of workers' comp involved, to include disability benefits, permanent disability, medical care, hospitalization, home health care, and death benefits. So there's a lot at stake. Next slide. For purposes of TTD, those of you who know about the workers' comp system, most doctors find TTD for 30 days or more, and they're certified for that period of time. In workers' comp, under this law, if you are positively tested for coronavirus and you want to be found TTD, you have to get a medical doctor to certify within 15 days from the positive diagnosis, and you have to have it recertified every 15 days for the first 45 days. So that means it's not a 30-day, 60-day window for you to be on TTD. You have to get a recertification every 15 days in order for defendants to pay for it. Next slide. Now, before we pay any benefits on the workers' comp for TTD, the injured worker has to first exhaust all of his paid leave under the Family First Coronavirus Response Act. So under this Response Act, you have at least 14 days that the employer has to provide paid leave before workers' comp TTD starts. So keep that in mind, because this paid leave could be as high as 12 weeks depending on the circumstances. And then at that point, workers' comp would provide benefits. Next slide.
And just a reminder for everybody that's on here, this is a mandated poster. So this should already be up. It's published by the Department of Labor, and they have it available in English and Spanish. And so make sure you have this up right now. Also, to view, they're in municipalities that have over 500 employees. We're now seeing new developments of emergency sick as well too. So depending on, again, this is for 500 or less employees. So for those employers that have over 500, make sure you're complying, you have the necessary posters, and you also set up your payroll correctly as well too.
Yeah, that poster should have gone out to all your employees by, I think, April 30th.
Correct.
All right. So now, once you have a compensable claim, presumed compensable claim, again, just to give you some idea of how it can expand, the law says any COVID-19 related illnesses. So what does that mean? That means, in workers' comp talk, from the applicant's attorney's standpoint, again, anything that can be related, like I'm stressed out because I believe I might die, or I might become seriously ill, and a doctor says under a psychiatric medical report that that's a compensable claim, and all of a sudden you're paying for that. A lot of these workers' comp attorneys file internal claims if you're taking substantial medications. And a lot of the treatment for coronavirus under the ACOMP guidelines right now is medications. So the medications affect your stomach somehow or your internal organs. That's going to be an added body part. Some people are placed into a induced coma, and I don't know if you heard about that Broadway star, but he has leg amputated. That could be a compensable consequence. Neurological incidents such as having headaches all the time. So you can see that a workers' comp case can be expanded under this law. And those who've been doing it for long enough know which of the attorneys will do that. And they will do that and expand the case right at the very beginning. And the reason I'm bringing this up is because workers' comp doctors that can say they know what coronavirus causes are few and far between. It's a brand new virus. It's going to be hard for a doctor to say that within reasonable medical probability that I feel that the coronavirus expanded and caused this, this, and that. So what we as defense attorneys are expecting to do is to really look at the qualifications of the doctors treating these workers' comp claims and seeing if they have the qualifications to address the issues. I think that's going to be a problem. The state of California is currently deciding whether to adopt the ACOM guidelines for coronavirus as the medical guidelines for these type of cases. And if they do, they're talking about things such as quarantine, what has to be in place for hospitalization, for intubation, for use of respirators, things like that. So the ACOM guidelines are likely to be the guidelines that we're going to use on workers' comp systems. So workers' comp systems are going to have to be prepared to utilize in their UR system these guidelines to certify treatment on these presumed compensable claims. So there's going to be a lot of question marks about doctors' qualifications and what insurance companies are going to provide and not provide. Again, benefits and treatment. A lot of the treatment that is being considered now under the ACOM guidelines for coronavirus include quarantining yourself for 2 to 3 days at home, maybe up to 2 weeks. People of high risk, people 65 years or older, lung disease, heart condition, obesity, diabetes. Those are risk factors that they're going to take into consideration as to whether to put people in hospitals, on ventilators, etc. Hospitalizations will become an issue, and how long you stay. Surgical costs will be high, and like I said, you can get TTD benefits as well as permanent disability benefits. The one thing that the law does state is that under permanent disability, all apportionment laws still apply. So when you take a deposition of an injured worker who has pre-existing, you need to get all the records from those pre-existing conditions so that apportionment can be fully addressed. And finally, death benefits are available if there is a dependent. If there are no dependents, then there are no death benefits under these circumstances. But if someone dies from coronavirus, of course, you need to be worried about death benefits for the dependents, ranging anywhere from $250,000 to $350,000. Okay. What should you do if you get someone that comes to you and says, I have coronavirus and I think it's work-related? Well, that's your first notice of a claim. And that means give that person a claim form right away, apprise your carrier or your claims office as soon as possible of the claim, because again, you have 30 days from that date to respond. Every claim, in my opinion, should be delayed. I don't think any claim that comes in should be accepted right away. You have to do your due diligence in investigating the case and take that time period of 30 days fully before deciding to accept that type of a case. Again, as soon as an employee comes to you and says, I have coronavirus and I think it was caused by my workplace, that's day one. So what do? You immediately delay the claim and start the 30 days. Make sure the presumption applies, meaning that you have a positive test or a diagnosis from a licensed physician or surgeon. Then you trace back 14 days from that date to see if that person ever worked at the workplace. And if they did, the presumption is likely to apply. So what do you do then? You need to do whatever you can in 30 days to rebut that presumption. So you do a thorough investigation. And what do you do as far as an investigation? Well, it starts with the workplace. You want to find out and provide your carrier as much information as to what's going on at your workplace. Have you been doing the social distancing? Have you been providing face masks and gloves? Have you staggered hours? Has there anybody else in your workplace been positive for coronavirus? You want to make it appear as much as possible that your workplace is unlikely the cause of that person's coronavirus. Provide that information as quickly as possible. Next slide. And then what I would highly recommend is that the insurance companies take the injured worker's deposition immediately. The cases that we've gone so far, we have been able to set a deposition within the 30 days. And those depositions should be set as soon as possible so that you can ask that injured worker if there's any other potential source. Any other potential source could be a reason to deny the claim. And if you have a basis to deny the claim, again, you only have 30 days to do so. And if you only have 30 days to do so, once you take a depo and find out where this person's been, or who else might have had coronavirus around them, you have whatever time is left to investigate to see if that would constitute a hotspot. So in my opinion, if you're going to deny a coronavirus claim, you're going to have to show somehow that it's more likely that that injured worker caught coronavirus somewhere else besides the workplace. And the signs of coronavirus are still going on, so it's still hard to determine that exact moment. But if you can show it's more likely than not that you got it from home because your mother has it, your daughter has it, your wife has it, and you're in constant contact with that person, that's, to me, more likely than not. If you went to church or you went to a restaurant or you went to a grocery store where there's a hot spot, where a lot of people contracted coronavirus on or about the same time, that to me might constitute more likely than not, especially if your workplace has no evidence of coronavirus or spread of coronavirus. I think that is possibly your best chance of getting a coronavirus claim denied within the 30 days. Again, I'm speculating because this is a new law, and I don't know how judges are going to interpret denials and determine AOE, COE. But from my vantage point right now, if I could show an alternate source of coronavirus that makes it more likely they caught it there as opposed to work, that is probably your best bet to deny a claim and get it upheld. And again, if you deny a claim that turned into a high exposure claim, such as hospitalization, ventilators, long-term damage to your lungs, etc., that could save you a lot of money. And so that's what we as a community have to do, because if you just could prevent one or two claims from being pursued because you had a valid denial, that alone will save you a lot of money. Just to give you some ideas, I know Tony will go over it as well, but I was told that they expect 31,000 claims just for the 4-month period that this law is in place. 31,000, of which 80% they think will be mild, but the other 20% can be very serious or lead to death. So again, prevention of claims and denial of claims are important. Now, what do I mean by prevention? As an employer myself, once this came down, we continued our office open as an essential workplace, and I had to do whatever I could to make sure it didn't spread in my office. So what do? You do a detailed assessment of the workplace and develop a plan to prevent. Train your employees to do what they can, wash your hands, wear your gloves, wear your face mask, social distancing, ventilation if that could be an issue. If you deal with the public, you want to do things such as walking spots on the floor, making sure that they're 6 feet apart. Plexiglass, I think plexiglass in the workplace between desks is a thing that's going to be utilized a lot in the future. Anything you can. In fact, there's ownership guidelines that have been issued about what to do as an employer, and there's also guidelines from the CDC. If you have a person that comes to work that's showing evidence of illness, like shortness of breath or dry coughs or whatever, you need to tell them to go home as a preventative measure, and try to tell them to isolate and recover. Stagger your shifts, stagger your breaks. In the break room, make sure people are not close to each other. Reposition workstations. Like I said, prevention is key, because the more claims you prevent, obviously the less you have to worry about the workers' comp costs and the workers' comp implications. All right, so that's my summary of the case law, and how to deal with it as an employer, as an insurance community person. But again, this is going to be going on for a while, and I think as time goes by, as any new law, it's going to evolve and change over time. At the end of the slides, you'll see my address, telephone number, and website. So if you ever have any questions, please feel free to contact me. And with that, I'll turn it over back to Tony.
Thank you, Peter. I know most of you have a lot of questions. I see them coming in, so please type away. I'm going to go over my portion very quickly so all of you can get in your specific questions. I've seen some really good ones. So, the key to all this is prevention, prevention, prevention. Peter's firm is great, but, once they're litigated, they're tough. And yes, we're going to try to deny them and everything, but you all know how it is having litigated claims here in California and what usually happens. So I know that most of you are trying to reopen, but reopen and be cautious. We have been giving people some updates in regards to from the WCIRB. So that's the wonderful government entity that provides you with your XMOD. And sometimes I let you guys know you've got good news, and sometimes I let you guys know your XMOD went up. And so they've been very instrumental in giving all of us in the community some updates, and wanted to pass that on to all of you. So Peter mentioned that there's a lot of concern in regards to the costs. They are going to be excluding COVID-19 claims from the experience rating. Really, they're not looking at those types of claims indicative to hazards in your workplace. And so in regards to if you are susceptible to COVID-19 claims based on you're a critical business or what have you, you don't have to worry. It won't be impacting your experience rating. So if you're at a 1 right now, congratulations. If you're at a 60 mod right now, doing even better. But what we don't know is in regards to from an underwriting standpoint with the carriers, it's going to impact your loss ratio. And so when you're looking at losses and who will be giving us quotes, while yes, your mod may not be impacted, but your loss ratio may be impacted as well too. So again, prevention is key for all of this, but this is actually something that's good for employers, because you won't see this artificial increase in your mod if you do have some COVID cases, especially for those that are in healthcare or even the grocery store clients as well too. Many of you had to make some changes in regards to the stay-at-home order. We saw a lot of clients calling us and saying, well, we do not want to lay off everybody because we don't know how long we're going to be non-operational. And so a lot of our clients were generous enough to continue to pay people, and they were at home, not doing any work. We started to get some of the phone calls from our clients going, well, I'm paying for payroll for my workers' comp, yet they're not here doing their job, and they're not on the premises. They're not around the hazards. It just doesn't seem fair that we would have to pay for people, one, because we're not fired, but artificially paying for them when they're not here. And so actually the payments that you've made, and for people that we're not doing, and the key word is not engaged in any work, okay? Not engaged in any work. So are your people logging into the server, checking emails? That is not engaged in any work. So, but for those that had dishwashers or greenskeepers, or those that were on the line as far as manufacturers, and they can't telework, but you kept them on, you kept paying them, they were using their PTO, you actually can exclude that from your reportable payroll. I've seen it done two ways. Either your carrier will say, we can make an adjustment, let me know what the payroll will be, or it'll come back to you within the audit. And we'll talk a little bit about that housekeeping and what you need to provide to them. The other one also too was a lot of you, many of you like myself, are now teleworking. And so you can actually temporarily assign the 8810 clerical class code for those people that were still doing their job, but doing it at home. And for those particular months, we've seen a lot of people, a lot of mid-level managers that actually were able to telework, and you can then modify that payroll for those months that they were actually teleworking as well too. So what we're going to see is the months of March and April, May significantly go down in regards to premiums because you're making that adjustment. What I'm seeing for our clients right now, they're having people that have still come to work. They're seeing people that were paid or not paid, or they were just doing absolutely no work. And then we see the people that were doing teleworking. So there is a little bit of an equation to put together for your CFOs as it relates to the paperwork. So in regards to record keeping, and now I know they're going back to a lot of the auditors, but what they're saying is that if you have any sort of internal memos, if you also have HR notifications, if you have HR status changes, or any sort of documentation saying these specific employees were impacted, either teleworking, stay at home, or staying as is. You can use those in regards to for your audit, so that way they can make those adjustments as well too. So we thought that the WCIRB was being very flexible. I thought that they understood the pain of the employers, and we've been now working with the carriers to make those adjustments. Like I said, it's either we're going to them immediately and saying, hey, this restaurant has closed, they have no payroll. Or what they're saying is keep paying, and then they'll make that adjustment. So contact your broker, contact your carrier, and see how they'll work with you, but definitely make sure you have your payroll records as well too. So again, going into a little bit more of the WCIRB, you know, one of the things that we were talking about amongst us as a group was what are we going to be seeing down the road in regards to the market. We are seeing that the EPLI, employer liability market, is shrinking right now. We're also seeing that the workers' comp market, they are very worried in regards to the type of claims. Also to the general liability market is getting worried in regards to third-party type of claims in regards to COVID. And so while yes, it may not impact your mod, but what will we be seeing in the next couple of years as it relates to, right now we kind of have a soft market in regards to workers' comp carriers that are here in California, but they did some just broad forecasting of what some claims will look like quickly. So this was kind of some key summary findings, and you know, they looked at the low range of being 0.3 billion all the way up to 2.0 billion. So in regards to what they anticipate, also the low range and high range, and the impact to the workers' comp system. These are just numbers that they're floating around right now, some estimates, but again, based on more information, we'll get more in regards to how it's going to be impacting California as a whole, and also to the carriers as well too. Peter talked about the medical costs. So they did some cost analysis in regards to physician visits, some severe ICU hospitalization, what that would look like, a death claim, and then also critical as well too. So as you can see here, I know all of you are putting in policies and procedures and best practices. It's very, very tough to maintain them. However, if you're looking at these numbers here, we need to make sure we're trying to avoid these types of claims, especially as you're trying to reopen. Again, they're not going to affect your mod, but will it be impacting your overall loss ratio and also to the workers' comp market as well? And again, to we talked about the indemnity costs as well. So what I'm also seeing too, the beauty of it is I've been able to talk to a lot of our clients, hands-on, seeing what's going on, and we are seeing the COVID workers' comp claims come up, and we're also seeing the stress claims being filed as well too. They don't have COVID, but they are scared. They were around somebody, and they feel that there's a stress claim in regards to working next to, with, or around this person as well. So, you know, again, we're seeing these straggler type of claims come on, and we're going to see more as well too. But again, from the medical costs, and then also to the indemnity, and then also to the other type of claims that the applicant attorneys will be adding on as well too. So just some reminders. I know that all of you have a policy in place. Some of you have a 2-pager, some have a 45-pager. I love policy. I don't really have a place. Also to remind people, as much as you can, enforce your policies. Somebody has to be the bad cop. If you have a crack in your system and you have someone that's not following your new normal, there could be that exposure. You could have 2 or 3 COVID claims, and then also to affect maybe your clients or members or vendors as well too. So who is going to enforce the policies? If you have a 30-minute, everybody washes their hands, who's enforcing that? Do you have a timer? Do you have a clock? Do you have a whistle? I already know it's hard enough for employers to make sure people clock in and out on time, take their rest and meal periods. Now we're having them do temporal screenings, hand washing, and cleaning their common area every 2 hours. But who's actually enforcing this? Document your policies, procedures, and trainings. I'm getting quotes from clients right now. And what are the underwriters asking for? They're asking for, I want to see the policy. I want to see their posters. I want to see pictures of their signs. Tell me the manufacturer and type of PPE that they have. Who's the protocol? And also, by the way, what trainings have they done? So from an underwriting standpoint for workers' comp, they want to see all of these things you're putting in place. And I think it does 2 things. It gets you the best rates. It shows your employees you're doing everything possible. And if you do have members, that you're creating the safest place possible as well too. So document, document, document. Be consistent with your policies. What you do for one, you do for all. I know that sometimes we cherry pick and we go, oh, you know what? Yeah, you're 100.5, but just go ahead. Go ahead. You need to be consistent. Please do not cherry pick. Do what you do for one, you do for all. Assign a COVID officer to enforce and be the point of contact for communication. I can't stress this enough. I don't know if it's you. Somebody needs to be that COVID officer or the COVID czar. Who's in charge of getting all the PPE? Who's making sure all the equipment is there? Who's making sure all the policies are being enforced and everybody is signed off on the policies, and they effectively are taking documentation of all the training, and they're the point of contact if you do have an outbreak. They know what to do immediately. They know how to contain it. They know what message to send out, and they understand the communication tree as well too. So that person should be assigned. And who is that person? And then also to a plan of action for a positive COVID-19 case. I can't stress this enough. If it hasn't happened to you, it probably will, unfortunately. As we're starting to reopen, as we're trying to congregate again and trying to the 6 feet rule, things will happen. We don't have a GPS on our employees 24/7, but have a plan in place. And one of the things that I am working on is an alert system, like a crisis management app. So that way, if you do have something, a choking, active shooter, or a COVID case, you press one button and all hands on deck. And then also too, the one thing that I've gotten from a couple of my clients, and they said it worked magically, was training the managers how to respond. It's critical. What are they going to say? How are they going to say it? Is it going to be professional, HIPAA compliant? Will they know how to take this person, set them aside? Making sure that your managers know how to react and they know what to do and who to call is critical as well too. So now on to Q&A. Miss Trish, we have a lot of questions, yes? Let's see here. So I'm going to start with, so Peter, are you ready?
Sure, I'm here.
Okay. So we have a client here. It says, if an employee has multiple employers, who will be responsible?
It's interesting you bring that up because the first case we got from coronavirus for the presumption was a person who was tested positive. But when we took that person's deposition, we found out that for the 14 days prior to that testing, that person worked for 2 different places, us and someone else. So our position has always been that if the presumption is going to apply to us, it's going to apply to them too. So we filed a petition for a joiner of that additional employer to at least share the cost. You only contract coronavirus once, but you don't know where and when. And if this presumption is going to apply to us and is going to apply without any evidence of where it happened, it should just as equally apply to a secondary employer, even if that secondary employer was part-time, less hours, etc. It doesn't matter, in my opinion. In my opinion, the presumption applies to both. It should apply to both. We'll see if that is the case when we litigate it, but we did file a petition for joiners. So that would be my initial response.
Great, thank you. Next question, if someone applies for and qualifies for a workers' comp due to COVID, does it make it easier for the family to sue the company on a civil basis?
That's an interesting question because the civil basis is something that's questionable. Workers' comp is if you file a workers' comp case, the reason you have workers' comp is that you don't have civil action. Now, civil actions, the only thing outside of workers' comp might be a serious and willful misconduct action. So the argument would be that if you have an employer that provided no prevention whatsoever, or placed the injured worker in a grossly negligent work situation, such as, for example, the meat packers that were in Illinois and that were allegedly side by side throughout the entire time period with no testing, that might be a situation where there might be a civil action that you can still pursue. But once you file a workers' comp claim, that's your remedy, and that should be it, other than serious willful misconduct and discrimination. So that would be my answer to that question.
Great, thank you. We have one here. If an employee has symptoms but has not yet confirmed that they have COVID, what steps do you recommend until we hear what the test results show?
Well, for prevention purposes, if you have anybody who has symptoms, the first thing you do is tell them to go home. The reason being is you don't want that to spread in case that person does have coronavirus. So you tell them to go home and self-isolate, talk to their healthcare provider, and get advice from them as well. If they determine that that person needs to be tested and they are tested positive, then you take the next step from there and see whether they want to file a claim. But before that person goes back to work, you may want to have that person undergo a return to work fitness exam to make sure they're well enough to come back to work. Again, prevention is key, and you don't want to bring anybody back to work who still has symptoms or may have coronavirus that might take 14 days to show symptoms as well. So that would be my initial response to somebody who's at work that's got symptoms.
Right, and what I've noticed too is that if somebody is self-monitoring, or they come to an employer and they say, I have a cough, I have a sore throat, I have a temperature, what I've noticed is that when HR talks to them and says, don't worry about it, go get tested, wait for the results. In the meantime, we're going to put you on this sick pay. and it's an emergency sick pay. And so really a lot of times the employee is worried about not getting paid. And so again, if they qualify, if they've been advised by a healthcare provider, experiencing COVID systems and seeking a medical diagnosis, it falls into that category, and then they can get up to 511 daily, right? So I tend to see that most employees are okay with not coming back and waiting, and then just letting them know, by the way, you're going to be on a paid leave. So that way too, you're protecting the workforce as well too. Another question we have, Peter, does an employer need to shut down the entire operations or just disinfect areas identified during contact tracing?
Well, that's something that you as an employee have to decide on your own. I have, for example, in my building, we received notice that there was a tenant that had coronavirus, and there was consideration of closing down the office for a while to allow the building to be disinfected. But what the building did was they told us that the person who had it had not been in the building for the last 14 days, had self-isolated by the time they found out about it. And once they found out about it, they advised us that they were going to disinfect the entire building, intense cleaning, but they were not going to shut down the building. So the building remained open, and because my building is maybe a third filled at this point in time, we kept open as well after the cleaning. But again, it's up to you as an employer. If you have a small, cramped workspace and a lot of employees, that definitely should suggest at least the closure for a day or two and intense cleaning before you take the risk of bringing everybody back. But that's on a case-by-case basis, in my opinion. It depends on your workforce, your workplace, your building, and what you do for a business. Assess the risk, assess the exposure, and act accordingly. But again, prevention is key. So if there's an outbreak, of course you need to close down. If there's an outbreak, you should close down, disinfect, and then bring everybody back later on when it's safe to bring everybody back. But in the situation I was in, the potential exposure was minimized. So we closed for a day and then reopened after they disinfected the building.
Thank you, Peter. Yeah, what I've noticed is that my clients that are slowly opening again and trying to communicate the new normal and the new policies and procedures, they had a COVID case and then had to shut down for 2 days. So they were so excited, to rehire employees, get everything in place, and then they have to be shut down because they did identify that they were in multiple areas of the location. So again, it's one of those things that take your time, make sure everybody is aware. I would even say you may have to give people a quiz so that way they know exactly what they're supposed to do, when they're supposed to do it, because I'd hate to see people do all this work of reopening and then have to shut down, and then also too, customers, members, and employees really being fearful coming back to work as well too. Peter, I have a question. I've been hearing, I was on a webinar this morning. I see a lot of employers putting in waivers and having not only employees sign a waiver, almost kind of saying proceed with caution. Also customers, members for some of our club clients, and also vendors that are coming and dropping off merchandise. I know that we can't waive our rights, and even if we, have a separation and everything, people can still file workers' comp later. Are you seeing that those were even hold up at all? And as it relates to workers' comp, those won't hold any water, correct?
Yeah, that means nothing, workers' comp. The resumption is in place regardless of whether or not you got it from work, and it's resumption. So to sign a waiver or anything that suggests that you are waiving your rights to your workers' compensation benefits will hold no weight. In fact, you might be sanctioned as an employer for doing that. If you have people working for you and they contract coronavirus, they have a right to workers' comp as well as whatever other benefits as an employee you would have. So my opinion, I don't think waivers would hold any weight in reference to workers' comp. As far as customers and outside people, that might hold some weight, but that's beyond my level of specialty.
Perfect, thank you. And then we have our last question here. Are face coverings PPE, since they don't protect the personal health of the person wearing it? Are face coverings PPE, so they don't protect the personal health of the person wearing it?
Well, you do the best you can. I mean, when the pandemic started, you couldn't get anything, let alone, gloves and hand sanitizer. So you do the best you can. I have in my office place face masks, and that's the only thing I can get my hands on. So I have face masks, and we are required to provide face masks and gloves at the workplace at our cost for our employees. So we do provide them, and although they're not perfect, they're not foolproof, it is a preventative measure that you put in place. Of course, if you could get your hands on preventive PPE that is even more efficient, then you should do it. But again, those things are very few and far between. I mean, just now, I think the first time I went to a CVS just last week, they had face masks. So it's hard to get anything. But I think as time goes by, you need to assess what you can get your hands on and provide what you can. So I have, for my employees, hand sanitizer, hand soap, gloves, and masks, social distancing instructions throughout the office, things like that. So you do the best you can with the availability of what you have.
Great, thank you, Peter. So, for all of you that are on the line here, clients, friends of ours, let us know how we can help you. We're kind of in this together, from policies, forms, postings to pandemic trainings, and also to a COVID response guide. We're all about prevention. And obviously, if you do have a COVID-19 claim and it is litigated, it could be quite a journey in regards to the cost of it and also to how long it stays open as well. Again, if you have any more questions, please let us know. We will be sending out the deck slide and then also to a COVID-19 memo from Peter and his firm as well. And for those of you that are friends of ours, we'll be having a COVID-19 Q&A session with Paul Fleck from Atkinson, Anderson, Loya, Root, and Romo. So for those of you that have specific questions in regards to your policy and procedures, mark your calendar for June 25th. We'll be having that. And then again, a special thank you to Peter. Peter, thank you so much for being with us today. It was very informative. We look forward to seeing if there are any new developments, and if there are, we would love you to come back and join us again. But thank you so much for your insight, your expertise, and some guidance on how to navigate through COVID-19 claims in the workers' comp sphere.
Anytime. So thank you for having me. And if any of you have any questions, feel free to reach out to me.
Thank you so much for joining us today. Again, be on the lookout for the recording, the slides, and also the memo. Again, if you have any questions for either of us, please feel free to reach out to us. Our job is prevention, and we want to support you during this time of need. Thank you again so much for joining us today. Bye-bye.